Hey everyone, and welcome back to Pickleball Pros. If you love pickleball as much as I do, you know it's a fantastic way to stay active, social, and have a ton of fun. But like any sport, it comes with its risks, and our knees often take a bit of a beating. Today, we're diving into some of the most common knee injuries pickleball players experience. Understanding these injuries and their warning signs is the first step to playing smarter, safer, and hopefully longer. Seriously, if you're experiencing knee pain, please see a doctor or physical therapist. This video is to help you be more informed, not to self-diagnose. So, why are our knees particularly vulnerable in pickleball? Well, the game involves a lot of sudden stops and starts, chasing down those dinks, lateral movements, covering the court side to side, pivoting and twisting, especially during volleys or quick direction changes, lunging, reaching for low shots. All these movements, especially if done repeatedly or with improper form, can put stress on the knee joint and surrounding tissues. All right, let's get into some common culprits. Injury number 1, meniscus tears. First up, meniscus tears. The meniscus is a C-shaped piece of cartilage in your knee that acts like a shock absorber and stabilizer between your thigh bone, femur, and shin bone, tibia. In pickleball, these can happen with sudden twisting or pivoting, especially when your foot is planted, deep squats or lunges to get a low ball, sometimes just an awkward landing. Signs and symptoms of a meniscus tear can include a popping sensation at the time of injury, pain, especially when twisting or rotating your knee, swelling and stiffness, often developing over a few hours or the next day, difficulty straightening your knee fully, a feeling of your knee locking or catching, tenderness along the joint line. Next, ligament sprains. Ligaments are tough bands of tissue that connect bones to each other. The main ones in the knee are the ACL, anterior cruciate ligament, PCL, posterior cruciate ligament, MCL, medial collateral ligament, and LCL, lateral collateral ligament. The MCL, on the inner side of your knee, is commonly injured in pickleball from a sharp, sudden cut or pivot, a force hitting the outside of your knee, pushing it inwards. Signs of an MCL sprain: pain directly over the ligament on the inner side of the knee, swelling, a feeling of instability like your knee might give way sideways. The ACL, deep inside the knee, is a more serious injury, often happening with sudden stops or changes in direction, landing awkwardly from a jump, though less common in pickleball than, say, basketball, pivoting with a firmly planted foot. Signs of an ACL tear: often a loud pop or popping sensation, severe pain and inability to continue activity, rapid swelling within a few hours, loss of range of motion, a feeling of instability or your knee giving out when you try to bear weight. Let's talk about patellar tendinitis, often called jumper's knee. This is an overuse injury affecting the tendon that connects your cap patella to your shin bone. In pickleball, this can develop from repetitive stress from lunging, jumping, even small hops or quick accelerations, sudden increases in playing time or intensity, signs and symptoms of patellar tendinitis. Pain is usually the first symptom, located between your cap and where the tendon attaches to your shin bone. Initially, pain might only occur at the start of activity or after an intense workout. As it progresses, pain can be constant during play and even interfere with daily activities. Tenderness if you press on the patellar tendon, sometimes swelling around the tendon. For many of us, especially as we get older, osteoarthritis is a reality. This is the wear and tear arthritis where the protective cartilage on the ends of your bones wears down over time. Pickleball itself doesn't necessarily cause osteoarthritis, but it can aggravate a pre-existing condition or cause a flare-up if you overdo it. Signs of an osteoarthritis flare-up in the knee: increased pain and aching, often worse after activity or at the end of the day, stiffness, especially in the morning or after periods of inactivity, swelling around the knee joint, a grating or crunching sensation, crepitus, when you move the knee, decreased range of motion. So, you've heard some common injuries and their signs. But when should you definitely see a doctor or physical therapist? Seek professional help if you experience severe pain or pain that doesn't improve with rest, ice, and over-the-counter pain relievers, significant swelling that comes on suddenly or doesn't go down, inability to bear weight on your leg or walk normally, if your knee locks, catches, or feels like it's going to give out, a visible deformity in the knee area, if you heard or felt a distinct pop at the time of injury, any symptoms that are worrying you or impacting your daily life. Early diagnosis and treatment can make a huge difference in your recovery and getting you back on the court safely. Understanding these potential knee issues is key to prevention and knowing when to take action. In our next video, we'll be diving into exercises and strategies specifically designed to strengthen your knees and help prevent these common pickleball injuries.